I'm a fairly new nurse practitioner. I was a nurse before that, working at University Hospital in the Children's Psychiatric Hospital. Prior to that, I was a respiratory therapist for over 20 years. I decided to become a nurse practitioner because we need more providers in Albuquerque. I realized that when I worked at CPH because we had nobody to send anybody to. I currently see patients from Lifespan. I do have experience with children from my past working at the Children's Psych Hospital. I really enjoy young adults and adolescents, so that's kind of where I stay, but I'm credentialed to take care of the full lifespan. Honestly, I do what I do because I have mental health issues. I have suffered PTSD 20 years ago. I've had chronic anxiety and depression. And I know that medications do help. It's not for everybody, but medications do help with therapy. And that's kind of why I wanted to do it, just to reach out and help other people. I think one of the things that makes a good provider is understanding what it feels like to have anxiety and depression and mental health issues. Personally, I've struggled with that. So I think that gives me kind of an insight of where people are when they come to see me. So it gives me increased empathy. My goal in practice is to help people be comfortable if they would like to take medications or to find resources for them so that they can go to psychotherapy. I tend to be a holistic person, so there are other options to medications. There's a lot of vitamins and supplements that we can do that can help. Oh my gosh, I did my practicum here. I was very fortunate when I was in school to do my therapy and to follow practitioners here. So I spent a year here with most of the providers and the therapist, and I got to see individual traits of the therapist. I really liked how they want the holistic part of the patient to feel good and that we work together very well. And I thought it was a good fit for me when I started working. I think in the past that mental health has had a stigma. But what I see currently in the current generations, it tends to be less of a stigma to reach out and get help for the way you're feeling. So I'm hoping that continues because it's really important for us to receive help for our mental issues. It affects everything in your life.